Well, hello, everybody. I'm Jeannie Blaylock here at First Coast News, and we have some fantastic news for you. You've probably been hearing us talking about the Apple Project. Well, officially, it has started today. That is the only free brick-and-mortar dental clinic in Jacksonville. It opened back in 2015. Lots and lots of people came. Then during the pandemic, like a lot of things, it shut down, but we are back up and running and ready to help you. If you can't afford a dentist, we are here for you. So you're probably wondering right off the bat, this is some pictures of the clinic here, what do I do to qualify? There are some things to do, but basically 2 things you do to qualify. You're low income and you have no dental insurance. And so you can call a number, you're going to see it here at the bottom of your screen, 904-573-1333. You can call and they can help you decide if you are qualified or not. There was a guy who talked to me the other day, and he had some different dental issues. He's in his 20s, and I sent in his paperwork for him to help him, and within 24 hours he was approved, and he has an appointment in about 2 weeks. He is having major dental pain. So we are happy to help, and we are glad that we are here. So I wanted to introduce a very special guest tonight. She is a volunteer at the Apple Project. Her name is Dr. Christina Monford. Thank you for joining us. We appreciate it tonight.
Thank you for
She's
having
at
me.
Tropea Dental at the Town Center. And first of all, why are you excited that we have this in Jacksonville now?
Well, so this clinic, I had heard about this clinic some time back, like almost a decade ago. But this clinic is very similar to that of a clinic that I was able to attend when I was a younger adult and could not afford dental care myself. And it's things like this that are available for those individuals that cannot afford it, and we can in fact get you some sort of dental help. And there are there'll be certain procedures that we want to be able to offer. However, a lot of these procedures are expensive, and it's not that we will always be in that situation, So the hope is to get, folks to not have pain or get them out of pain and free of infection.
Right.
And just to get them back on their feet.
So let's talk about the pain first of all. Let's say you're having horrible tooth pain. I mean, that's people have been describing it to me. I have to be honest, I've been blessed. I haven't ever had a toothache. You have. How would you describe how badly it just hurts?
Oh my God, it is. It's terrible. It can destroy your entire day. It is miserable. I know every now and then I get a patient in the clinic, and sometimes they can barely have a conversation with me. I sometimes have to get them numb, give them some local anesthetic just to be able to
deal with it.
Just to have a conversation.
And so I've been meeting people at the clinic who are having such bad tooth pain that they soak their cereal, or they try to just kind of mush mashed potatoes all day long and just barely, they can't chew, they can't eat, they're in pain. And so, but if you went to a regular dentist and you had to have a tooth pulled because it is causing you so much pain, how much can that cost at a regular dentist without insurance?
So with general dentists, that can range anywhere from $250 to, and I mean, some may run specials, but it can run anywhere from $250 to maybe $500. It just depends, if there's a surgical versus a simple, so $250 to $500.
Yeah, and we just saw the gentleman there. You saw him had a vest. Obviously, he was retired military. Mm-hmm. We saw him in a video a little bit earlier. Uh-huh. His name is Ed. And Dr. Monford, I've been following him for a couple years. There he is right there. And he served on 7 aircraft carriers, 20 years in the Navy. But because he wasn't 100% disabled, he says, the VA would not pick up any dental help for him. Mm-hmm. So he had a tooth pulled at a regular dentist. Took him 3 years to pay it off. So the next time he was having pain, he went to the dental clinic, the Apple Project, and it was totally free. So let's talk about why it's so important to get those teeth out sometimes. You just can't say, oh, I'm tough, I can deal with the pain. It's more serious than that.
Absolutely. Tooth infection, a lot of these cases, they do not make it to the media, and it can be fatal. Tooth infections can, in fact, result in what we call sepsis, and there have been a number of cases that sometimes they're not as evaluated to determine exactly where the infection has come from, except that if there's someone that might have been, say, famous even, that that's the reason, or not reason, but sometimes that's how we are able to get that information out there, that it is not just simple and it does not go away as far as just getting, say, an antibiotic, that's only going to, dim the situation. But if that abscess is there, you have to get it removed for sure.
So if you guys don't mind, we have a picture of an infected tooth because I didn't realize what it looks like. So we're going to run that video. If you're squeamish, you might look away a little bit. It's not that bad, but tell us what we're looking at. That's a tooth that's been pulled, and what's the gel-looking stuff?
That is an abscess. That is an abscess at the root of the tooth. And believe it or not, as small as it is the most painful thing that you can imagine. It is very painful.
And that's the infection, and that's what can spread. Like, where does it go?
So it can get into the bloodstream. So that small little abscess, that's like a capsule filled with bacteria, and sometimes what will happen, that's more localized. However, when you see that patient or that person that has a facial swelling, that's a little more, generalized swelling that we need to, they need to be on some really serious antibiotics, because at that point, that's uncontrollable, such that they may even need IV antibiotics. So at that point, they really need to go to the emergency room first to get the swelling and infection under control before we can even decide to, pull any teeth.
And we want to make the point, though, that ERs are not dental clinics. So if you go once or twice, I've met people who've been there 3 or 4 times, they got antibiotics, and they're like, I still hurt. It doesn't solve your problem. You need a dentist.
Absolutely, yes. So the most emergency clinics are going to tell you, here's an antibiotic, maybe some NSAIDs, and they'll say definitely see a dentist. Again, the antibiotic is only to calm the situation. It is not the actual result that's going to take care of it completely. You have to remove that source of infection if you want to be free of pain.
Yeah, and I've heard people try all kinds of things. Bless their heart, there was one lady, and you're going to see her on the news, but she was showing me where in her mouth she's tried Oragel, like over and over and over again. She's been to the ER. She's tried acetaminophen and all this stuff, and she said, it's still killing me. It's just still killing me.
Absolutely. And I mean, I always explain to patients too, oftentimes when we take too many of those meds, it can be a little tough on the stomach or the liver. So these pain meds that we're taking to try to calm the pain, until you get that tooth removed or taken care of, taking those pain meds can also cause other problems, such that, over usage of those can definitely cause a toxicity to the liver or the kidney. So, definitely see a dentist for sure.
And I want people to know, I kind of thought when I started this project that I'd be seeing quite a few elderly people, but there are people already at the Apple Clinic. They're in their 20s and 30s. I talked to one guy who's working 2 jobs, one at Publix and one, I forgot the other place, at a restaurant, a fast food place. But he's still qualified. He's still low income enough. Mm-hmm. And he doesn't have dental insurance. He qualified for the Apple Clinic, and he was telling me his face was it hadn't been that day, but before, was all swollen up, the whole side of his face. The swelling had gone down, but the infection was still there. So Absolutely. It was important that he get there.
Absolutely. And I mean, considering age, like you said, I mean, yes, there are, older individuals, but there are younger people and patients that are out there that, they, probably were, did not have the access to care as they were coming up. That's how I relate to this project. I did not have the access to care as a kid. My mom, believe it or not, my mom was in the dental field, but my mom was suffering from drug addiction. And so I did not get to a dental, clinic as often as I could have or should have had, and so I too ended up with a toothache. And luckily for me, I was able to save the tooth with root canal therapy. But it's people like these dentists that are volunteering. We hope to get more volunteers, but it's people like that stepped in to help me out, and I was able to save that tooth. And some people are not though, so it is important to definitely see about getting some form of help.
And we were just looking at some video from inside your own dental practice at Tropea at the town center. But I'm glad you shared that story, because I want you all to know that the dentists volunteering for us, they're not paid a penny. I've talked to every single one of them. They all have some really deep, passionate reason that they want to help. So they care about you. And that's what Dr. Monford is saying, that you experience struggles in your own life. And so you understand, not everybody has just got money on a tree and they can just go pay for a dentist.
No, absolutely. And I mean, there's been a shift. And so, I'm a firm believer of, I want to walk in my purpose, and I love what I do. I know people hear me say it all the time, but it's not a cliche. I do, in fact, love what I do, so it's not work. And just giving back. I want to pay my dues. And there were people that I know that stepped in and helped out. And these days, this time, it's rough for a lot of people. But it doesn't mean that it has to end for them. It doesn't mean that there's not any hope. And so I am able. I'm able-minded. I have physically and mentally able to perform procedures to, in fact, do something to give back, and that's what I want to do.
We are so grateful for you and all the other dentists there. In case you're wondering, where is this clinic? It's at 5126 Timuquana Road, and we built it from the ground up. The community back in 2015 raised $1 million to make this happen. We work with Dolores and Wayne Weaver when they owned the Jaguars, and Haskell Corporation. They did a lot of the pro bono architectural work. I mean, schools and business people were coming out, and they all had the little slogan. If you were here back then, you probably remember, I've appled, have you? And Dr. Monford, we have some video of you and all your staff getting excited about the Apple project. So let's play that. We can't hear it, I don't think, but we're going to be able to see you guys dancing in your hallway. Look at you guys. And there's a point to this, too. I'm showing it because I appreciate your support. I've appled, have you? But I love the way you're called the dancing dentist, because people are nervous when they go into the dental office. And how do you make them relax? You don't always dance for them, but just your attitude's so up.
Well, I always tell patients, we're not the most liked healthcare professionals out there. In fact, I always say, we have the hooks, the drills, and needles. And so I like to aim on the side of getting you to a comfortable place and not having to depend on sedation or laughing gas even. I have plenty of laughing gas, but I want to work on confidence. I want to boost that confidence such that when you get there, yes, you might be nervous initially, but I want to get you to that comfort level of having the urge to be able to come, and then come on routine basis and not only for emergencies. And so the idea behind that is, just learning my patients, learning how to read body language. And, sometimes I sing. And so not only will I dance, I sing. But no, I mean, and believe it or not, it does calm certain patients. And, just being able to just relate to everyday people. That's what it's all about, realistically. That's it.
And I want you guys to know, who are listening, if you're thinking, I think I could go, but I might be embarrassed, I might be scared. I've seen men break down in tears because they're so grateful to have the help. I've seen the assistants hold the hands of people. I've seen a lot of comforting things there at the dental clinic, and almost always people say, that wasn't so bad, I'm so glad I did it, and they just say, thank you. And then I talk to him, and like Ed, the veteran I told you about, he hadn't had an apple forever. He loved Granny Smith, so I went to Publix and I bought him a Granny Smith apple, and I took it over there, and he took a bite of the apple for the first time. I mean, he couldn't even bite into a little cookie before. He was so grateful. He goes, oh, it just tastes so good, So there's so much joy. It's just a really neat atmosphere over there, and I hope people will just feel like they can come and be welcome. And speaking of volunteer dentists, what would you say to people out there who are listening? We need what? Dentists, hygienists.
Absolutely.
And then also volunteers, and you have to have your blood pressure taken, so they will train you if you want to just come be a helper. You don't have to be certified in anything, but can you give your pitch to get other volunteer dentists? Because the more we have, the more we can be open, because right now we're open 2 days a week, and we could be open 7 days a week. They've got 6 dental chairs. And so, come on, convince people to come volunteer.
Well, so, and I definitely want to reach out to, of course, some of the dentists that I know and those that may be watching. This is our community, and it's not every day that, we get to give back. We have, I host free dental days at my office, and I don't get to to host them as often as I'd like. And so it's like that one day every year or two. And then there's other programs that come to town. But again, it's like maybe once or twice a year. And it's like, that's just not enough. And even if so, when they come, I know there was a program that had come some time back, and I wanted to volunteer, but I was leaving town. So it's like, oh man, I'd love to, volunteer and help out, because it is a need. It's a strong need, especially after COVID. There's been a big shift of people, working from home. And so, the caries risk has been on the rise. People are working from home and they are, eating more snacks. And so we're seeing a large influx of folks that are coming in with dental pain and decay. And so in this situation, it's one of those things where you can actually find a day and time that you are able to commit once a month. It feels good being able to give back. I have to admit, so I don't know. We got to figure out this this way of definitely encouraging folks. But again, that one time a year is just not enough. There's a large need that's out there, and what better way to be able to use your talents, your skills, to be able to give back to our community. But yeah.
Yeah, I mean, you said once a month, that's the key. They are asking, of course you can do more than once a month, that's great, but they say if you're a dentist or a hygienist or you can be a helper, if you can just come for 4 hours once a month. They'll even open up on Saturday for you because they really need some help. We have people now, but the more dentists that volunteer, we can get people off the waiting list. And right now we have more than 150 people on the waiting list. And now that we put this on TV, I'm sure we will have a lot more. So if you can volunteer, you can call that number right there, or you can go to that website right there, and you'll see a little page there where you can volunteer, and that would be just awesome. It doesn't take a lot of time, and you can add more time if you can do it. You can be a retired dentist as long as you have a license. And we should point out that you have sovereign immunity because it's a nonprofit, which means if something would happen and somebody would try to sue you, they can't sue you. We've never had that situation come up, but you are totally protected by law, and you just have to have an active dental license, right?
That's right.
And so we need you. So please come and volunteer. Let's talk about the services that are provided at the dental clinic. You can have a filling put in. Mm-hmm. You can have x-rays. Mm-hmm. You can have a consultation. Mm-hmm. You can have extractions. And they have a full, what's it called when it goes all the way around your head?
Panoramic.
Okay, panoramic x-ray. And also the dentist will confer. I've seen them confer over the x-rays and try to come up with a plan for you. And the other thing I wanted to bring up is you can go have your teeth cleaned for free if you qualify for the Apple Project. And so what's the value of that if you had to pay for it out of pocket?
For a healthy mouth cleaning, that means without just what we call gingivitis, that can range anywhere from 80 to 125, that depends. If it's a deep cleaning, there, in the presence of what we call periodontal disease, that is, that will be a little more extensive of a cleaning, and that can range anywhere from $200 to $800 in a dental office. So again, this is a service that will be offered, especially if we can get more volunteers to help out, but there's definitely a need. So
if somebody's thinking, well, I brush my teeth, why do I need to come to the Apple Project and have my teeth clean? Why do they?
Well, brushing is one thing. However, we build plaque literally by the minute, and there are small calcium deposits, or what we call plaque deposits, that solidifies. And so the brush is not hard enough to remove that plaque, and that plaque is called calculus. It's hard tartar. And so that will build, and so it feels almost like a little rock on the back of the teeth, such that it can cause bone loss. And so as it continues to build, the bone will continue to, you start to get bone loss. And so you'll get something called periodontal disease, and so we don't want that. But we have to use special tools and instruments to remove that hard plaque and tartar, and that a brush will not remove. So.
And I want to point out too, if you're not into maybe making a phone call or you don't want to go online, you can actually just go over to the dental clinic at 5126 Timaquana. It's easy to find right off of Roosevelt, right off of 17, and they have applications there, and you can talk to somebody. I've seen people just walk in the clinic and say, hey, I need some help. And the other thing, too, about it is I don't want people to be embarrassed. I was telling Dr. Monford, when I've been over there a lot, and I've seen people come in with masks on, not because they're trying to protect themselves, because they're embarrassed. I had a woman I met the other day who wouldn't put her hand away from her face because she said, I don't want anybody to see my teeth. And everybody told her it's okay, we're here to help you. And what would you tell people who are just embarrassed to even go out now because their teeth are not in good shape?
Every now and then I get that patient that will say, I'm so embarrassed. Don't look in my mouth. And I'm like, well, no, this is definitely not the time to, we don't want anyone to be ashamed. We realize that, sometimes we hit rough patches, and that's that grace that I hope to have people understand that, we get it. Things happen, whether it be, health concerns or whether it be, lack of education. And so these are things that happen. And so, that's not something that will, stop us. Like, the idea is for us to get you in, educate you, and, help to get you healthy, removing, infection, helping you to for preventative care, for the cleaning. So you may have someone that may not have actual tooth infections, and so we want to get them in there for preventative care. And I think preventative care is also the best care. But educating them, and hoping that they go out and they are able to, tell everyone else, if this is that clinic, if you happen to just, fall short or have things going on, because sometimes that happens, people have, for whatever reason, things, whether it be homelessness or, loss of jobs and sickness, whatever those things are, that will, come across and have us to be in certain situations. We don't judge. It's not our thing. We're not going to judge you at all. Absolutely.
I love how you said that, because Dr. Heather is another dentist. She's a volunteer dentist. You met her.
Yes.
She's retired military. She served 25 years in our military, and she's a specialist in
endodontics,
in root canals, right? Yeah.
Yep.
So, but and you'll hear her say this later on this week on First Coast News, where she says, "We do not judge here." Which I think is so cool.
Absolutely.
I mean, we don't judge. And I think that's a big thing here, is it's not just the physical care, but it's the mental care too when you go in. And so I want to talk a little bit more about the infections. So if you have a tooth that's super painful, will that infection just go away on its own ever?
No, not until they're, one, tooth infections. If the tooth is savable, we can perform a procedure called root canal therapy, where we remove the nerve tissue out of the tooth. That is if the tooth is savable. Okay, and then there's that. What if it's not savable? If it's non-restorable and it needs to be extracted, again, this is an infected tooth. It has to be removed. So there's two different realms here of possible procedures. Not saying that the Apple Project will offer root canals yet, but the hope is to get this project off the ground and rolling, such that we can be able to save teeth. Because again, I was that kid. I had a tooth. I had a toothache. It was infected, and I was able to have it saved with root canal therapy. So I still have that tooth right now. So I mean, I am so thankful for that.
You got that done. Yeah.
Absolutely.
And, we're talking about the effect on people too. Besides just being embarrassed, I mean, I've had quite a few people explain to me the names that they're called, because they have teeth that look like they were drug abusers. I mean, this one woman kept saying, everybody says I'm a druggie. You must have been doing drugs. You did this to yourself. And she said she hears, even when she was in high school, she would hear the comments. So I guess she never had a chance to have good dental care. Now, the Apple Project is for 18 and over. Maybe sometime we can add a pediatric clinic. But right now, you're talking about people who've been dealing with this for a long time, the rude comments, looking down, not getting a job. One woman said that she had bad teeth because she was epileptic, and she would fall. She had these accidents. She was young. She was really a beautiful woman, but she didn't want to open her mouth. I mean, she'd go to a job interview. The minute she'd start to smile, they always kind of stopped the interview. So a lot of this too is trying to get can I say rotten or bad teeth out, so that you can function and eat and be back in society.
Absolutely. And so, it's funny you say that, right? It's like, not funny, but you bring up the seizures or even childbirth. Some women, we have, when we bear children, we tend to sometimes vomit a lot. And so vomiting is acid, and so or acidic or low pH. And so if they're constantly vomiting, and if they've had multiple children, that can in fact cause a mouthful of decay. I've seen it, and oftentimes, some dentists will say, well, it's not that pregnant women, this is a big thing for pregnant women. I'm like, yes, it is. As we are bearing children, the baby, the fetus is going to get the nutrients that it needs. And so as that's happening, if you're not eating as much as you need to, and or if you're vomiting a lot, then, this is, constant, acid being touching the teeth. And so with that acid, that low pH, it causes decay. And then there's that diet. So again, as I was saying earlier too, you got, there's that change in since COVID, folks are working from home. And so what we've seen a rise with is that, I've heard people come in and they'll say, since I haven't had to leave the house, I haven't brushed my teeth in 3 days. So again, that's that, it was a shift that took place. And so there's, again, diet or, the lack of, brushing, our hygiene, oral hygiene. And so, yes, it's definitely, it's a big deal.
Well, I think something else we've seen, too, at the Apple Project is people who are ready for chemotherapy, they have cancer.
Yes.
And they can't get cleared for chemotherapy or radiation because there's a tooth infection. They will not start that without infection. So then they say, well, I can't afford to go to a dentist. And they say, well, I'm sorry, we can't treat your cancer until you get your infection out of your mouth.
Yes.
But at the Apple Project, we can help them.
Absolutely. And so when it comes to that, what happens is radiation. And so radiation will kill some of the bone cells, especially if there's any radiation that takes place in the head or neck area. And so as it's, killing the bone cells, in addition to killing some of the salivary glands, the activity of it, these patients are more prone to decay, but also should they have any teeth that are infected that need to be removed, if this should happen after they have that radiation, they can develop what's called osteoradionecrosis, where the bone does not heal and it is a bigger, nightmare. And so that's why it's important that they have, make sure that there's no infection present, and no
point.
need for
very important.
The
other thing I've noticed that, and since I'm not a dentist, not an expert, but like I said, I've been over there a lot, and I've been impressed with some things I've seen, particularly how the dentists are so willing to follow up on the patients. I just overheard a conversation the other day. This man had a couple teeth pulled, and the dentist was walking him back down the hall to the door, and he said, "I know you've got my number. If you're having any trouble beyond whatever it was, like 2 days it should stop hurting or whatever, just feel free to call back and we will help you." And so there's follow-up there too. And sometimes in the medical system we don't see that. And I was talking with the head of Sulzbacher, Cindy Funkhauser, and she says in her view, if you look at the entire healthcare system, the biggest gap is dental. And that's why she's excited to see us do the Apple Project. At Sulzbacher, there's a sliding scale. There are some other affordable, but this is free. And again, you qualify basically if you have two things. You're low income, and there's a chart, and they can help you see if you qualify as low income and you have no dental insurance. Those are the people that we are trying to serve at the dental clinic. Apple Project. So you can bite into an apple. Did I say that? All right, did I make that clear? That's the whole reason the project was called Apple Project. Everybody kept saying, I can't bite into an apple anymore, and that's why it started with the Apple Project. So, but really, if you have any questions, feel free to reach out to me. I should have put my number there on the screen, but you can find my number at First Coast News. We will be doing the Apple Project at 6 o'clock for the next 4 nights. So we started tonight at 6 o'clock, and then we'll go Friday, and then Monday, Tuesday, and Wednesday. You're also going to see an NFL player who passed away because he had a tooth infection. It was sepsis. And he
Absolutely.
was 35, 36. And so that's the serious side of it. But you also see people who are just so excited that they can eat again, and you'll, I think, feel very comfortable about asking for help. So do you want to just say one more time to the dentist to come volunteer in case
Yes.
somebody's just tuning in?
Absolutely, yes. If you are a licensed dentist and you are retired or retired, we are definitely just trying to get the message and word out there. There's a number of patients that are on this waiting list. We did, in fact, have a clinic that was also helping, and so a lot of these clinics have closed down, and there's just not a lot of access to care. And again, this is our community. We have the resources. We have there's a ton of dentists here, and it's not to say that who should or should not do this, but if it's on your heart and you want to help, please come out and help. That would be amazing. And it's not just dentists, just as she said, hygienists, dental assistants. If you are interested even in the dental field, definitely reach out to maybe even volunteer just to get some hours in for that. Just even seeing if you're interested in coming into the dental field. It's a lovely field, very, very lovely field. I love the dental field. But please, definitely, if you are able, there's a lot of people out here that are in need, and our free dental day we had, I'll never forget. There was people that showed up at 1 o'clock in the morning to get in line because we were only going to service the first 50 people. And so that says a lot, I'm like, ooh, they were here at 1 o'clock in the morning, and so that says a lot. And I mean, again, that was only one day. And so this is something that we can do. You can set your day and time, with the clinic to find out, give them, that time so that you can help serve this community.
Well, Dr. Christina Monford from Tropea Dental at the Town Center, thank you so much. I've enjoyed getting to know you. I love your enthusiasm and your passion and your heart. I know you really mean it. So again, for some reason you just tuned in, we are talking about the Apple Project. The Apple Clinic is built, it's paid for. That was back in 2015. The community raised $1 million, and there it stands at Timuquana. It shut down during the pandemic. It took us a while to get back up and going because it's a nonprofit, but we are back open with the Apple Project, ready to help underserved people with no dental insurance or people who are low income. So if you think that's you can't afford a dentist, maybe you're in pain, maybe you want your teeth cleaned, you have some sort of issue, just please call that number you see right there, or just go visit the clinic at 5126 Timuquana, or go to that website and look for patients, and you can fill out a form. It's really not that hard, and we are happy to answer any of your questions. So Dr. Monford, thank you so much.
Absolutely.
And we
Thanks
hope
for having
this
me.
helps you in some way.
Absolutely.
Good night, everybody.
Good night.